Hello everyone, welcome. Today we'll know one of the patient who had a major stroke in the brain, aneurysm in the brain which was ruptured and which was causing life-threatening complication. We did the minimally invasive surgery to seal the aneurysm, which is called endovascular coiling of the aneurysm. Let us see how we did the procedure. Stroke survivor, Basilar top aneurysm. Hello, dear all. Welcome. We would like to share a real story of major brain stroke survivor. He's an engineer, had a major hemorrhage in the brain. Major vessel near the brainstem called basilar artery was affected. On the weak area of the vessel, balloon-like wall was ruptured, causing major bleeding. In a medical terminology, it is called basilar top aneurysm. We had to treat it to prevent further bleeding to save his life. We treated him by endovascular coiling. We did small needle puncture at the groin artery, reached the weak spot near the brain through tiny wires and micro catheters, and plugged the platinum coils to fill the aneurysm. He showed gradual recovery. He was highly motivated for the recovery, himself enthusiastically involved, and was doing exercises even when he was at work. He is showing progressive recovery year by year. We are happy to see him swimming. God bless him and let him do well. Let him be motivation for others for the stroke recovery. Let us see the procedure. It's a picture showing aneurysm. It's a balloon like structure over the vessel. Second image showing a rupture of the aneurysm causing pouring of blood into the brain, which can cause damage to the brain or dissection of the brain and causes life threatening complication, including major neurological deficits. We had taken him to the procedure room. It is called cath lab, where we insert tiny needles, wires, and catheters to reach the weak area of the brain where aneurysm is formed and which has ruptured. Through these wires and needles, we reached the weak spot and did the DSA called digital subtraction angiogram, which is showing the aneurysm as it is shown. The round like structure is aneurysm. It is the called lateral view, one more view, and this is the one more view showing balloon which is placed across the aneurysm. Vessel name is called basilar artery and PCA, posterior cerebral artery. It will be behind our skull. This two dots we are seeing, it is balloon. One more view, closer view, and from very far we are seeing the monitor during the procedure showing balloon across the aneurysm, and micro tube called microcatheter we placed inside the aneurysm to fill the platinum coils. And coil, it is platinum coil, slowly it is being inserted inside the aneurysm as it is shown. After placing few coils, aneurysm is secured and we placed all the coils to fill the aneurysm including the neck. Till then the balloon was protecting. Suppose inadvertent rupture of the aneurysm, it will causes stoppage of the bleeding. And aneurysm is completely filled by the platinum coils as it is shown. It is one more view showing the aneurysm filling, and other vessels, major vessels are patent, and other vessels are not damaged or gone into any kind of narrowing, we called vasospasm during the procedure, and it is other vessels are nicely seen. What we did, this aneurysm balloon like structure as we are seeing here, which was ruptured, we saw in the beginning this image, and what we did was endovascular treatment of cerebral aneurysm. As we see here, the blood is flowing through the vessel and also into the aneurysm, and aneurysm is a weak spot which can rupture like a time bomb, and we place the micro catheter as it is shown, which is getting filled by the platinum coils and completely filled including the neck, and now blood will not enter into the aneurysm and it will flow across the vessel and aneurysm will be secured. What inventory we used? Long sheath, guide catheter, microcatheter, balloon, 360-degree coils, and helical coils and ultra helical coils. Summary: young man presented with bleeding in the brain, grade 4 SAH it is called, and he was in coma. Major vessel aneurysm was formed called Basilar artery. Minimally invasive or pinhole surgery was performed. Endovascular coiling was performed to seal the aneurysm. Now he is back on his feet, back to work, and happy to see him swimming.
Last yeah. Week, and you keep in the second life. And I try to make it. Because I will be more improving myself.
Thank you, thank you, thank you again for watching this video. Please share this video to the maximum and create the awareness regarding the stroke. If there is any patient, neighbor or relatives, if you come across this kind of problem, visit the neurosurgeon and take the treatment. Brain stroke is preventable if it is detected early. Remember, facial weakness, arm weakness, leg weakness and difficulty in speaking fast, you have to reach the hospital where the stroke facility is there immediately. Thank you.